So we're on video 4. My name is Dr. Sharon Obadia. I'm a general internist and I'm the Director of Faculty Development at A.T. Still University School of Osteopathic Medicine in Arizona. So in video 4, we're going to talk more about providing feedback to medical students. So we all know how, as a medical student, we loved receiving feedback, and hopefully it was good, positive feedback as to how great we were doing. It's not always the case, so we'll talk about how that can be phrased in a way that the student can learn from the experience. So feedback should always be kept in mind, keeping in mind when we're giving feedback, always undertaken with the teacher and the trainee working as allies toward a common goal. And that is the improvement of the student's performance and patient interactions and clinical reasoning skills. Feedback should be expected. The students should expect to get feedback on these rotations, this clerkship with you. It should be at a mutually agreed upon time or place. That can be very hard, but once you and your student are in a rhythm of the month, then the student will expect, after they see a patient, they get feedback from you after they've given their presentation. Most effective feedback is given close in time to proximity of when the event occurred. So if you are able to give feedback right after that student presents a patient to you, that's the optimal time. And try to limit the feedback to digestible quantities so a student can really reflect on what you said and grow from it. And try to keep it specific and limited to the behaviors you really need them to work on and the behaviors that you thought they did really well. So keeping it specific and making it specific and not just saying, hey, great job. Try to really be specific as to why was that a great job, or that was not so great. Let the student know what you thought needed to be worked on. So feedback, again, should be specific, non-evaluative, and non-judgmental. Feedback should be given on decisions and actions and not on our interpretation of the student's motives. So really sticking to the actual actions that you observed or the decisions that you understood the student to be taking with the patient care. Some tips for offering one-on-one feedback. As I said, being specific and give an indication of where the students have done really well or where they need work on. So another great tip for this is first off asking the student to reflect and tell you what they think they could improve on or what they thought went really well as well. This time of self-reflection can be a great opportunity for the student to give you their thoughts as to how they think they did, and then you can go from there as the teaching points. Be tactful and cautious when using humor. Sometimes the humor, teasing, or sarcasm that we have, many of us have been a witness to or a party to, we don't realize how, we may remember as students how damaging it can be, and we may not realize how humor can come across to a student as very crushing to their spirit, and we may not even know if it's misinterpreted or not. So a lot of communications with students are now done through email, and so I just wanted to touch on that a little bit. Try not to overreact to awkward or seemingly rude written emails from students. Oftentimes students don't realize how the faculty might be interpreting their tone. To me, I've always noticed that student tone can be very more casual than I'm comfortable with in an email. So a student may write, "Hey, Dr. Obadia," as their greeting, which I think is too casual. And I actually do tell the student that I do think that's too casual, and then attending out in the future may not appreciate that. So they often don't realize how that might be interpreted, and so assume the best intentions and ask for clarification when you don't, when you feel that the tone wasn't quite there. Oftentimes the student doesn't realize how it's coming across in an email. Use multiple methods for communication depending on what's available to you and your students, and you can do this with feedback and what's appropriate for the type of feedback. So if you're comfortable giving your feedback through an email or even a text when your student's on the busy month with you, just do something that you're comfortable with and you feel like your feedback's getting across. I think the optimal feedback is, of course, given in person.